Today we are going to discuss about this bone that is called sacrum. This is a kind of large triangular or wedge shaped bone. This is a composite bone. That means this actually is formed by the fusion of 5 sacral vertebrae. 5 sacral vertebral bodies are there, and that whole bone is formed by the fusion of the 5 sacral vertebrae in general. There must be some exceptions. Okay, and what are the presenting parts of this bone? It has one base, one apex, as I have told that this is a triangular shaped bone, so it must have one base, one apex, one pelvic surface, one dorsal surface, 2 lateral surfaces, and one sacral canal. Now come to the base of the sacrum. This is actually composed of the first upper surface of the first sacral vertebra, and it is the body of the first sacral vertebra, and these are the 2 lateral masses. Now this anterior edge of this body of the first sacral vertebra is called the sacral promontory, and this sacral promontory is actually directed downwards and forwards, and this forms an angle with the lumbar vertebra above, that is the 5th lumbar vertebra. There forms an angle that is called the lumbosacral angle. And these 2 lateral masses, I have told you that these are actually called the ala of the sacrum. This ala of the sacrum is formed by the costal element at its anterior 2/3 portion, and posterior 1/3 portion is formed by the true transverse element of the vertebra. You should have known that what is the costal element and what is the true transverse element of a vertebra. So now you have known that this is the upper surface of the body of the first sacral vertebra, that is the base composed of this body and the ala of the sacrum. Now this ala of the sacrum has rough lateral part and a more or less smooth medial part. This lateral part is covered by psoas major muscle and some part of the iliacus muscle, but this medial portion, this medial smooth portion, is traversed by 4 important structures from lateral to medial: obturator nerve, iliolumbar artery, lumbosacral trunk, and sympathetic trunk. Okay, we actually remember it with the oils mnemonic, but you shouldn't tell this. This is the oils. Obturator, from lateral to medial: obturator nerve, iliolumbar artery, lumbosacral trunk, and the sympathetic trunk. So now you have to know that this sacral canal is actually confined by the vertebral arches of the both sides, that is the pedicles and the lamina and the articular processes of these vertebrae. Okay, and above this superior vertebral notch, that is this superior vertebral notch actually transmits the 5th pair of the lumbar nerves, and the lamina, this lamina of the first sacral vertebra provides attachment to the ligamentum flava, and this anterior margin of the body of the first sacral vertebra provides attachment to the anterior longitudinal ligament, and the posterior margin of the first sacral vertebra provides attachment with the posterior longitudinal ligament. So now come to the pelvic surface. This pelvic surface is this one pelvic surface actually presents 4 pairs of pelvic sacral foramina, and as I have told you that this whole bone is formed by the fusion of the 5 sacral vertebrae. The fusion lines in between the bodies of the sacral vertebrae are present here as the 4 longitudinal ridges. These are the longitudinal ridges. These are nothing but the fusion of the first and second sacral vertebrae, second and third sacral vertebrae, third and fourth, like this. Okay, and so now come to this pelvic sacral foramina of one side. This pelvic sacral foramina has a sharp medial margin. Okay, and this pelvic sacral foramina actually communicates with the sacral canal. Okay, this actually communicates with the sacral canal. In between the two pairs, in between the one each pair of the pelvic sacral foramina, in the median space, this is actually remains in relation with the median sacral artery. Fine, and up to this third sacral vertebrae, it provides it is in relation with the pelvic peritoneum, except the upper left of the midline, there provides the attachment of the sigmoid root of the sigmoid mesocolon. Now come to this pelvic sacral foramina. Just medial to this pelvic sacral foramina, there lies the sympathetic trunk. Obturator nerve, iliolumbar artery, lumbosacral trunk and sympathetic trunk. This sympathetic trunk runs along the medial margin of this pelvic sacral foramina, and just lateral to this pelvic sacral foramina, there is the lateral sacral artery. And you have to know that from the lower part of the third sacral vertebrae downwards, this does not come in relation with the peritoneum, so this is non-peritoneal, and this comes in relation with the rectum, and there occurs the bifurcation of the superior rectal artery in between the rectum and the bone. Okay, so now come to this. Okay, another point I have missed. In between two pelvic sacral foramina on one side, there is a bar of bone, right? These bars are nothing but the fusion of the costal elements of the vertebrae, and this provides attachment of an E-shaped muscle, like this E-shaped muscle, that is called the piriformis. It has one vertical limb and 3 horizontal limbs in between the first, second, third and fourth pelvic sacral foramina. Fine. Now come to this dorsal surface of the sacrum. This dorsal surface of the sacrum provides 5 important longitudinal crests. First one is this median sacral crest. This in the midline, so this is the median sacral crest. This is formed by the fusion of the spines of 5 sacral vertebrae. Okay, and just above the median sacral crest, on each side there are 2 articular processes, and these 2 bears the articular facets which are directed downwards and backwards. Why? Because these articulate with the inferior articular facets of the 5th lumbar vertebra. Okay, and this is also a plain synovial joint, that is the zygapophyseal joint. Okay, so I was discussing about the median sacral crest. Now you can see that on each side there are 4 dorsal sacral foramina. Like the pelvic sacral foramina, there are also dorsal sacral foramina. So these are the dorsal sacral foramina, and through these dorsal sacral foramina, the dorsal rami of the spinal nerves comes out, and through these pelvic sacral foramina, the ventral rami of the spinal nerves, that is the sacral nerves, comes out, and these are in communication with the sacral canal. So median sacral crest, dorsal sacral foramina, and in between these median sacral crest and dorsal sacral foramina, there is another crest. You can see it closely. This is the intermediate sacral crest. This elevated ridge, it is the intermediate sacral crest, and these intermediate sacral crests are formed due to the fusion of the continuous row of the articular tubercles. Okay, now you can see that below this median sacral crest there is an inverted U-shaped opening. It's an inverted U-shaped opening. This is called the sacral hiatus, and this is formed by the failure of fusion of the laminae. These are the lamina of the upper vertebra. So this is formed by the failure of the fusion of the lamina of 5th sacral vertebra. So this is called the hiatus, sacral hiatus. And you can well observe it that where this intermediate sacral crest ends, there lies 2 elevated processes which are directed downwards. These are called the sacral cornua. These sacral cornua are attached with the coccygeal cornua with the intercornual ligaments. So you have known already that this is the median sacral crest, dorsal sacral foramina, intermediate sacral crest. Now there comes the lateral sacral crest, which are outside this dorsal sacral foramina, and these are formed by the fusion of the continuous rows of the transverse processes of these 5 sacral vertebrae. Okay, so I have told you that the dorsal surface presents 5 important longitudinal crests. What are those? Median sacral crest, intermediate sacral crest, and lateral sacral crest. So there are 5. Now you can notice that the below, this is the sacral hiatus, inverted U-shaped sacral hiatus. Through this sacral hiatus, which structures emerge out? One pair of the 5th sacral nerve, one pair of the coccygeal nerves, and one phylum terminally. Okay, and here provides the sacral cornua, or the sacral margin of the sacral hiatus provides attachment to the superficial posterior sacrococcygeal ligament. There is a coccyx below the sacrum. There is one coccyx vertebra, you know. So in between these sacral cornua, or the margin along with the margin of the sacral hiatus and the coccyx, there is one superficial posterior sacrococcygeal ligament, and one deep posterior sacrococcygeal ligament that is attached over the dorsal surface of this 5th sacral vertebra. Fine. And in between these 2 ligaments, like the superficial sacrococcygeal ligament is above, and there is one deep posterior coccygeal ligament below. In between these 2 structures, the 5th pair of the sacral nerves and one pair of coccygeal nerves and the phylum terminally emerge out. Okay, now come to the lateral surface. This lateral surface is wide in its upper part and somewhat narrower in the lower part, and this abruptly gets much narrower to form these inferolateral angles. Okay, and just opposite to these inferolateral angles, these lateral surface provides attachment from behind forwards, gluteus maximus, sacrotuberous ligament, sacrospinous ligament, and the coccygeus muscle. Okay, now let us start with this L-shaped surface, that is a part of the lateral surface. This lateral surface is actually composed of one L-shaped auricular surface and one deeply pitted posterior surface. Okay, this L-shaped surface, this is L like inverted L. This has one ascending limb and one horizontal limb. This surface is also known as the auricular surface. Why? Also the articular surface. Why? Because this looks like a pinna of ear. This articulates with the corresponding articular surface of the hip bone, that is this part is ilium. So like this, though it is of not that individual of whom this has been inscribed. So like this the articulation occurs, and there is some undulations like the elevation in upper and lower part and the deeper area in the intermediate region. Why? Because these undulations are very much needed because of the stability of the sacroiliac joint, and this stability is actually happened at the expense of the mobility of this joint. This sacroiliac joint is a plain synovial joint. Okay, so that is all. Now come to this sacral canal. This sacral canal, this has in one upper opening of the sacral canal and lower opening. This lower opening we know it as the sacral hiatus. This sacral canal, what are the structures passing in? The caudal extension of the cauda equina, and it is covered by the spinal meninges. Okay, and these communicate with the pelvic sacral foramina and the dorsal sacral foramina. At the end of the sacral hiatus, the only emerging structures are the one pair of fifth sacral nerve, first pair of the coccygeal nerve, and the phylum terminally. Fine. Now you have to know that what is its anatomical position. For the anatomical position, the points are, you have to hold it like this. And what are the points in favor of holding this bone in this way? The sacral promontory should face downwards and forwards. Likewise, the pelvic, you have to identify the pelvic surface or dorsal surface, and I hope you will be able to identify which one is dorsal surface, because there is a median sacral crest. There is nothing like that in the pelvic surface. Pelvic surface is concave, and this concavity of the pelvic surface should be directed downwards and forwards. Okay, so it is a midline bone, so there is no need to identify the side of the bone. And now you have to know that whether this bone is of a male individual or the female individual. The differences are, the male sacrum becomes is very much longer and narrower, whereas the female sacrum is wider and shorter. So that is why the sacral index of the male sacrum is almost around the 105, whereas of that female sacrum is of around 115. Sacral index is measured by the maximum width divided by maximum length into 100. Okay, and the next point is that the concavity of the pelvic surface of male sacrum is very much uniform, whereas in case of female sacrum the concavity happens abruptly, almost at two places in between the second and third sacral vertebra and fourth and fifth sacral vertebra. Like there is a concavity at two places, and the concavity becomes more prominent at these two places. And another point of difference is the, in case of male, the fusion of the coccyx, the lower vertebra, and the sacrum happens at an early age, but in case of female this fusion actually occurs at a very late age. Why? Because the coccyx at the sacrococcygeal joint, till it fuses, it helps in mobility at this joint. And why this is important? Because these backwardly pushed coccyx or the mobility of the coccyx helps in parturition, that is at the time of the delivery or the birth of a baby. Okay, and another point is this is not a very much important point, but actually it can be found that this auricular surface in case of male extends almost up to the third sacral vertebra, but in case of females the auricular surface almost ends at the level of the second sacral vertebra, but in some cases this also extends up to the third sacral vertebra like the male one. So these are all the differences in between male and female sacral vertebrae, but from here you can well, I think, identify it as the male sacrum. Okay, the uniform concavity, and there are other features like the sacral index. Okay.